So with constipation, then we see an increase in occurrence with people who have five or more medications. It's called polypharmacy, so increased medications, increased age because our GI tract, like any other of our organs, slows down with age. Someone with limited mobility, someone who has had suffered from a stroke or some other neurological disorder, someone who abuses laxatives or has abused laxatives in the past, someone who follows a low fiber or high fat diet, someone who does not drink enough fluids, or someone who has frequent enemas. Those are all reasons why um, somebody may experience constipation. So, what are we looking at for the treatment there? Higher fiber, adequate fluids, regular exercise, and then some medications. This might be laxatives or it might be stool softeners, just so to relieve from some of that pain from passing those stools. Diarrhea, obviously we want to find out what's going on. Do they have some sort of GI bug that they need medications? But particularly with the elderly and the very young, we want to make sure that we're treating with some sort of oral rehydration solution like Pedialyte or Gatorade. As much as I hate recommending Gatorade, that there's a few instances where um, that would be a good option so that someone can replenish those electrolytes, the sodium, the potassium, and then just get some calories in as well. The next condition is gastroesophageal reflux disease or GERD. Basically, this is heartburn. Um, it is the medical term for acid indigestion. And this is what happens when, remember that lower esophageal sphincter, which is at the top of our stomach and the base of our esophagus, um, when we're looking at the GI tract, when that relaxes um, because of too much pressure in the stomach, that's when we get those real acidic um, fluids coming out of the stomach and up into the esophagus. So it's called heartburn, but it really has nothing to do with our heart. It's just the general geographical location where we're feeling that pain. If someone has chronic GERD and it's not treated, this can lead to a stricture, which would be a narrowing of the esophagus from a buildup of scar tissue related to that acidic chyme basically coming up into the esophagus over and over. And those folks then are at greater risk for esophageal cancer. So some of the things that we're looking at, you can look at page 107 in your text for MNT here, but limiting spicy foods, tomatoes, citrus fruits, and juice. And the thing of it is that these foods don't cause this to happen. It just irritates that scar tissue or where that acid has worn away at the esophagus. So a lot of people think, oh, tomatoes makes me have GERD. No, it's that it irritates that spot already. Limiting alcohol, caffeine, mint, and chocolate, all of those increase the pressure in your stomach and will therefore then cause that lower esophageal sphincter to relax. Smaller amount of foods, lower fat. Why do we want a lower fat intake? Well, fat stays in your stomach longer than the other macronutrients, protein, and carbohydrates. So the longer we have food in our stomach, the more likely that we'll have um, a chance for heartburn. Lifestyle modification goals, that would be, losing weight, not lying down after eating because we want gravity to work in our favor. Um, and, following those medical nutrition therapy goals. Next, we're going to talk about other gastrointestinal diseases like gastritis, which those of you in medical terminology know that gastritis is the inflammation of the stomach. And then peptic ulcer diseases. Peptic ulcer disease would be an open sore in the stomach or the duodenum, that first section of our small intestine. And that mucosa, remember that mucosa is covering the whole area of our GI tract from mouth to anus. That mucosa is eroded away and the nerves are left exposed then.